today, though we are constantly bombarded with insecurity news in our country, we have decided to discuss something that has to do with the opposite, which is safety. On today's edition, we are shifting into the healthcare sector of the country, and our focus is the ongoing vaccine exercise in the country. While the country records low vaccination rates compared to other countries, medical experts have raised the alarm over vaccine existence, urging the federal government to declare a state of emergency on COVID-19 vaccination and stop relying on donations. To discuss this important topic of the vaccination and the strategy of the government and effort on the Ministry of Health in this sector, we have with us a public health physician. Welcome, Dr. Perpetua Mbanefo. I hope I pronounced that well.
Yes.
Hey, it's a pleasure to have you on the show today.
Thank
most
you.
times I always want those people that will practice when I sit there, I just blunder. Anyway, going straight to the conversation at hand, I know below 2 million Nigerians, representing 0.9% of the country's population, have been vaccinated thus far. So my question is, what is the accountability in relating to the small figure, despite the challenges that we are facing regarding pandemic and the scale of Nigerians at hand when it comes to the vaccination?
Okay. Before I go into that, I want to know, have you been fully vaccinated?
I know you asked me the same question yesterday, and you know the answer. Please, don't put it on the spot.
Okay. Well, there are multifactorial reasons why, you know, Nigeria is not doing well as a country when it comes to the vaccination uptake. You know, CNN will tell you it's less than 1%, like you rightly said. Apart from religious beliefs, the propaganda going on about people, they don't trust the vaccine manufacturers and their reasons, several other reasons. Another thing is the budget cut down. Sometimes the government are not able to procure these vaccines to make it available. And sometimes the vaccines are available, but people, due to fear, and some people don't really believe that the COVID-19 virus is real. So these are some of the reasons. And another problem we're having to ensure sustainability is that until Africa as a continent can take up manufacturing these vaccines, that's when we can assess them, distribute it properly, and ensure people are taking it, are able to get these jabs as often as possible. Because I don't think having a first round and then people come to the health centers and they said it's finished. We have to wait until they get a grant, or UNICEF sends, or some other funding organization sends. So these are some of the reasons why.
The beggarly nation it is. And, someone says we beg for everything virtually.
Sadly.
Despite our wealth. My concern with COVID-19, and first of all, I hope I'll get to my concerns, but in the area of the government trying to create some restrictions or some, would I say, order in terms of restricting persons that haven't been vaccinated from participating in some public spaces or public events when there hasn't been adequate arrangement or adequate provision to ensure that the population that would be vaccinated will be covered by what is on ground. Doesn't make sense to me. I wonder how that appeals to you.
Well, it really doesn't, but sadly we don't have the resources to procure enough vaccine that would cover the population of Nigeria. We don't have that. So with the vaccines that are available, because at the beginning, some people have already gotten the first dose. So when you go to the health centers to take your first dose, they'll tell you, no, now they're giving second dose. This happened to me. So I had to wait for a while when they finish those that have taken their first dose, and I can now come to take my first dose. Why? Because we don't have enough. They don't want people who've taken the first dose to miss their chance when they're due for the second dose, when they're giving people for first dose, because we don't have enough vaccines. And that's because of resources, which is why they'll tell you that about 1.9% of low-income countries, they are the only percentage that can get the vaccines. Why? We don't have the resources. If we have enough resources, I'm sure there'll be enough vaccines to reach everyone. And if you go to a healthcare center, there will not be any reason to stop you from getting your vaccine, as long as you're of age and you're an adult.
Dr. Mbanefo, I'll say welcome again to the program.
Thank you.
Thank you. Behind
yes, thank you very much.
I'm just going to say that there's been so much misgivings
you know, deriving from the various conspiracy theories.
Sure.
Okay, so question now is, how do we get to disabuse the minds of the common men on the streets? How do we do that? Because in the first place, there was this forecast that in Africa, people were, there were going to be, dead bodies were going to be littering the streets. And you find out the same people you saw from the start in the marketplaces, they're alive, they're well, they're still there, and they'll tell you, no, it's government propaganda. Question now is, how do we disabuse their minds?
Well, I would say education, re-education. We ourselves will start from understanding the virus, understanding the situation, and then you can educate the people around you. That's the only way. We educate people, and gradually, because now a lot of people are coming up to uptake the vaccines, unlike before. A lot of people are now coming up. They're now believing in much more because they see people who've taken it and they haven't died. They've seen people who have taken it and they are okay. Okay, so that is why. And because people thought that after a while it's going to phase off. After the, you know, the manufacturing companies must have sold a lot of their vaccines, the virus is going to be a thing of the past. But it's still there, and the numbers are still rising. So that's why people are now believing in much more than before.
I'm glad with what you've just done, because I know that apart from people dying, there are quite a number of other conspiracy regarding this, and I know that according to NMA on the vaccine, the Nigerian Medical Association says that Moderna has up to 94% ability to prevent people from coming down with symptoms of Covid-19, and also 90% ability to prevent or preventing people from coming down with severe form of diseases or disease and all of that. So please, can you break this down for those our viewers who are listening presently to understand it better in terms of the differences I just laid out?
Okay. The thing is, whether you're getting Moderna, the vaccine from Moderna, or you're getting from Pfizer, it is still a vaccine, right?
Okay.
For COVID-19 virus. And I keep telling people, some protection is better than no protection at all, right? So there are some individuals who would come in contact with the virus and show no symptom at all. There are some people who have the vaccine, still test positive to the COVID virus, but are not showing any symptoms. Even those on Pfizer vaccines, likewise Moderna, okay? So I cannot tell you categorically it's just for Moderna. People respond differently. So your response is unique, okay? So what I encourage people is, if Moderna is accessible to you, please go and uptake, go and get the jabs. If it's Pfizer that is available to you, go get the jabs. Because it's a virus. And to be honest, having some protection is still better than relying on just your body's immune system.
What I don't get is why the controversy, the huge controversy, and you've said, look, whether it's Moderna, Pfizer, in fact, we've hardly barely mentioned AstraZeneca here. These are the major guys, Johnson & Johnson as well, that we know that are into the production of this vaccine. But my trouble is the content of the vaccine. I've not been able to, see where the contents were brought to light as to what is the composition of this vaccine. That I'd like to find out from you. And why do people react in such a way that I know firsthand somebody who took it and she bled for 3 days,
Really?
Yes, firsthand. Yeah, it
Bleeding
wasn't strange.
from where?
It's not even strange.
Is it from the nostrils or something?
No, from her private.
Oh, really?
And I had to read it up, and I saw it's not strange. So
some people can have
it's
that.
strange. What's strange is to hear you, a professional, say it's strange, because
no, because I haven't heard.
I looked it up online, and it was all over. It was everywhere, and I said, okay, how did we miss this from the public space? How did we miss that? If you take this, you could bleed. And then why do people fall ill just shortly after taking it? I still have someone who just sent me a WhatsApp message last night saying, I just got my jab and I've been down.
Okay.
So give me a while, I'll get back to you and all of that. Why do people fall sick? Why do people bleed?
Okay, don't forget that it's still a virus that is contained in that vaccine. It might be attenuated, but it's still a virus. So of course, when you take it as a virus, you're going to have some symptoms. Some people might have nothing. I took it, I didn't feel anything the second jab. The first jab, I felt a bit lightheaded. I had slight headaches, but that was it. Some had fever, some were weak, muscle myalgia, some had body aches. Okay, your response to it is different. Yes, there are some findings that you might have some bleeding disorders, you know, some bleeding and all that. But I haven't seen a patient who had. Most of my clients haven't. Most of the doctors I know have taken it, haven't. Okay, but that doesn't mean it cannot occur. I say strange because I haven't come in contact with a patient who has. Okay, it can occur. If you look it up, there are several side effects of the vaccine. And there are still people who took it and had none. So again, it depends on the body system and how you respond to it.
But categorically tell me. Don't just sit here and tell me, oh, some protection is better than none.
Okay.
I don't want to hear that. Categorically tell me what I stand to gain.
Okay.
You know, from taking the virus. I mean, I've seen people who've had the virus and died. I have seen medical practitioners who have come out to say, look, if you hadn't had the virus, it probably would have been worse. And I say, what's worse than death? A deadly death? You know. So categorically, because Kike, they say if you take the virus, it doesn't stop you from being infected. If you take the virus, it doesn't stop you from infecting and passing the virus over if you take the vaccine. So tell me about
the benefits of not taking the vaccine?
I understand. This same question people ask me every day, and it's understandable. Number one, you can take the vaccine. It contains a virus, like I said. So what it does is initiates a response in the body. So your memory cells are activated, so they recognize this particular viral antigen or something. So that subsequent infections, the body system are already, they've seen it, it's not a foreigner. So they know how to mount response against it subsequently, which is why some people might tell you that if you take a vaccine, subsequent, you might have a virus, but you will not have symptoms. Some people still go ahead to have symptoms, but it's milder because the body has seen this virus before, it's had memory cells, and it can respond to it quicker and you know, subdue that. That's one. Secondly, people can have the vaccine and still have test positive. Some can test positive without symptoms, like we said, and go ahead to infect others. Don't forget, they have the virus, which is why they tested positive. So of course they can infect. They can transmit because they have the virus. That's one. Secondly, some can have the vaccine, test positive, and might go ahead to die. Why? There are so many other factors. They might have chronic disorders, the immune system might not be good, they might be inflammatory, several other factors. That you got the vaccine does not mean you have 100% protection. They keep saying this. It does not mean 100% protection, which is why I said some.
And I think that is why most people are still struggling with the fact that should we take it, even though we also know that it cannot protect us whether we do not take it. So now, Nigerian authorities aim to vaccinate over 40% of its population, or 80 million people by the end of this year, and another 30% by the end of 2022. So I must ask you as a doctor, what strategy do you think that, or would you advise, or do you think that they need to, you know, bring on the table to cover the projection to achieve the immunity of this vaccination? Because as we've analyzed on this table, that most people are still struggling to want to take the jab. Okay. The government having a projection is all good, but if the vaccines are not available, how are they going to meet that projection? The same projection is made for Africa, 60% by 2022. If we don't have this vaccine accessible to people, if we're not distributing it to all the geopolitical zones, if we're not making people understand why they need to come up for it. So again, we need to educate and re-educate people.
Mass education.
It's still key. Because if they don't understand why they need to take it, still the same questions you ask. If they don't understand why they need it, if they don't understand why the average educated people or seemingly educated took the virus and still died, they will be skeptical, they will be cautioned, there will still be that fear of the virus and the vaccine itself.
Dr. Mbanefo, our scientists, are they doing anything at all? Because we're talking about the scientists, you know,
scientists.
Yes.
Like,
I know I'm saying that. I know I'm saying that. You know,
how many schools are even, paying attention to?
Kike, I'm just trying to
researchers.
I'm trying to bring this to the
in our laboratories.
Why am I saying what I'm saying? You must have heard of Dr. Imoisili, from the University of Aberdeen. That's a Nigerian, one of the greatest scientists of our times. You know, he was on radio again. I've listened to him twice. That's a Nigerian. He's not from space.
Yeah.
Do you understand? And he says that there has to be continuous research.
Yes.
So that we will know the vaccine, you know, that is suited for us here. So the research has to go on and on.
Yeah.
I just can quote him verbatim, but when you listen to him, you will know this is somebody who knows what he is doing.
True.
Question is, do we have scientists in this country?
We do have.
And if we do have, what is happening? What should be done to help them? Because it's very easy for the government to always, you said it just now, kind of like indirecting the defense that we don't have the resources. Why do we not have the resources?
My dear, this is questions beyond this discussion. It's questions beyond me,
Yeah.
right? But again, the same question someone posed, that why are we not looking at these vaccines manufacturing ourselves?
Yeah.
Why are we not analyzing this COVID-19 virus strains? Why can't we categorically say currently the strain in Lagos State is this?
Sure, that's exactly
Why
what
are we
he
not
said.
saying that the greater percentage of people that died from COVID-19 virus was of this strain because of this?
That's exactly what he was talking
Yeah,
about.
so we still need to build our capacity to carry our research in our institution. We need to enable our doctors and our researchers, give them the resources they need, build these facilities. Of course, there are some researchers going on.
Yes.
However, are they empowered to do more?
You know,
That's the
talking about empowerment, because we know a lot is going on presently when it comes to the medical sector. I would also want to examine the current health workers strike that is ongoing, and the deadlock between the government and the medical doctors that is yet to be resolved, even though I saw yesterday that the Lagos State governor created time to meet with them. I think he said, according to the news that I read on the platform, that they've reached an agreement and all will be resolved. But the question is, what are the issues, you know, as a doctor yourself? But do you have any resolution at hand? Because I feel that these things are things that happen year in, year out, and doctors go on strike. What can we do to avoid all these, you know, back-to-back challenges that we face in our health sector?
Okay, so this issue is just one big problem in itself. Yesterday I was at lawsuit, to get an eye check. Let's be honest, this strike, we all know these strikes come and go, like you said. However, what the resident doctors are asking is not ridiculous by itself. Improve the working environment. I've worked in lawsuit. Improve the working environment, the public hospital space. Review the hazard allowance. Come on, these people take risk with their lives. Review these fees. Look at the payment strategy and some other demands. It is not out of place for the government to meet it. But because our government, we don't take our healthcare system seriously, because this is a very passionate issue. I must tell you. They don't take it seriously. Imagine the number of doctors that troop out of the shores of Nigeria
On a daily.
on a regular. I'm telling you, they're not going for holidays. They're not going for shopping. They're going out.
Yes.
Some are going for permanent stay, some are going for employment, and they don't care. They're not
We
coming
saw what
back.
happened with the Saudi Arabia when they were
And the
coming to
countries
shop
are
for,
opening their hands to
I'm telling you.
receive
and all
them.
of that.
So with that in mind, won't the government look into keeping the doctors you have in place
You know, and
to work?
I'm glad with what
They
you
will
just
do
that. They do that.
I'm glad with what you've just asked, because I know the Minister of Labour and Employment, Dr. Chris Ngige, claims that Nigeria has enough medical personnel to cater for the population. So is this statement true with the available statistics showing that the country has a patient that is ratio to 1 to 6,000 patients against the World Health Organization, WHO, that recommended that 1 doctor to 600 patients? Because with what you've just shared with us now, do you understand? Which I can see how passionate you are when you were talking about this, and I can feel it, because these are the challenges we are facing. You will see that all our ministers, all our presidents and governors, you know, they go outside to receive medical attention.
Medical
Medical
health.
If this medical sector is being well taken care of, just like you said, things will be better. What do you think is going on with 600 patients in 1 doctor?
My
grossly overworked.
My dear, these are the records that they have. If you go to some places, it might be much more than that. Because always our records are never accurate.
Never. Because we don't have data.
We don't have data. We don't have a database.
I don't have anything to say with what Kike said. He should produce the doctors.
Yes,
if he has them somewhere. I don't know. But I know that there are some hospitals that are looking for doctors. Doctors are not readily available.
I just hope that Kike will take you up on that. Produce the doctors. If he
no, he won't. Trust me.
Well, it's interesting we're having this conversation. My thought, I'd like to, for lack of a better word, grab all I can from you at this very little opportunity. It's nice Kike has shone a light on that sector in general and not just talking about COVID-19. The fact that there has been so much complaints about how doctors in public hospital treat. I mean, look at you, wonderfully looking, and I want you to be my doctor. I mean, the way you're talking,
Thank you.
But the scenario isn't the same when you go to these hospitals and you see one very...
In terms of customer service?
Yeah, customer service and how you're treated.
Long queues.
I'm sure more than 95% of Nigerians watching us right now would agree that, look, they were one time treated very, very badly and rudely. Why do you have so many badly, rudely people, nurses in your and doctors in your profession?
Let me answer for her. Even with all the challenges going on, is that not enough for them to even do transfer aggression on the patient?
I mean,
in as much as I'm not saying that is right,
Yes.
because there's etiquette, there's work ethics that must guide your profession. Do you understand? But let you take a dive.
Okay, let me answer
responsible? Yes.
for myself. Right? When I was a house officer, if I tell you I wasn't overworked, it will be putting it lightly.
Yes.
I was extremely overworked.
That made you rude?
No, I'm coming.
No.
Relax. After working for hours, you do get fatigued, right? So essentially, I bring it down to the minimum to save a life, right? So you leave etiquette. There are certain things that you leave for the either if it's a place where they have the front desks, if it's a place where they have people that get them together. If a patient comes to you, yes ma'am, what is the complaint? Because there are people waiting and you have till 5 o'clock to finish and then go to the ward, do a round and do this. So you really don't have the time like the private hospital to sit down and say, oh madam, oh, is that what happened? So most time patient will tell you that the doctors are always in a hurry. It's not like we don't want to take the time, but there's someone out there who has other serious complaints, not making your complaints belittling your complaints, but there are so many. No, see, go to the hospital.
Even in labor, I've had somebody say in labor, Kike, this lady was in labor and they were telling her, madam, push now, you go die, we go leave you, such things.
No. I'm not in support of that.
Is she waiting to go treat the person who's going at reception?
I'm not in support of that.
And
I'm not saying that's why the person said that, but I'm telling you my own experience, having been in the hospital sector. Sometimes several departments on consultation days, you need to go and see the crowd waiting to be consulted. So that's what I'm saying. The labor room is a different place. They should follow their etiquettes and handle it properly. I'm not in support of that, the way they respond.
I would like to interject here now. Just in line with what he said. I've met one of the best doctors in this country. Dr. Idris. Unfortunately, Nigeria has lost that doctor to Australia. He was a Blasut, a family physician, wonderful gentleman. There's such doctors. They're everywhere. So it's not the aggrieved ones who probably have their own issues coming from home. It's in all sectors, not just in the medical field. You find them everywhere.
Thank you.
So I just want to say that that's the honest truth.
All right. All right. Thank you very much. That is the reason why when you travel abroad and you see Nigerian doctors, most patients don't want them to touch them. But until people start convincing them that that's the best hands they have in the hospital. Again, many thanks for creating that.
Give a round of applause to our Nigerian doctors as well.
Yes.
Even the one at home, it's not easy.
All right, guys. We have a caller from Abuja. Janet from Abuja. Many thanks for calling. All right, please make your
hello.
Yeah, what's your perspective on the topic at hand? Please go ahead and reduce the volume of your TV set, please.
Okay, I've done that.
Yep.
Okay, I have a question here. Is regarding this COVID-19 virus. I heard about that. I heard somebody said that once you contacted that virus, that COVID-19, and you are being treated and you're okay, you don't need to take the vaccine again because you are a carrier. You already have the virus. So what I want to, first of all, I want to cover, is that true? And secondly, if that's true, why then people have to take that COVID-19 vaccine? Why are they, some people keep on telling me that you have to take it before you travel out of the country. So why is it compulsory? If you already, for instance, I am a carrier already, I have that.
All right,
COVID-19.
thank you, Janet, for your question. Please go ahead, Doc.
Okay, what I will say is this: if that were true, many states, even outside the country, will start testing you before they give you a vaccine, right? But that's not the case. If what she's asking is true, before you go for your vaccines, they would first test you. If you're positive, they'll tell you, oh no, you don't need it. But that's not true. I have a US doctor that he got the virus, he tested positive, was treated. When he was okay, he went for his vaccine, he's been fully vaccinated. So that's not
after
so.
treatment, you should still get the vaccine.
Yes. Yes. If that was the case, if you come for, even outside the country, if you come for a vaccination, they'll tell you, oh no, you must be tested first.
All right, we need to move on.
Yeah.
Again, all right, we have Edward. Edward, many thanks for calling from Benin. Edward, make it count and make it fast.
Live.
Yeah, go ahead, please.
Yes, please, COVID-19 issue that they are raising here. Yes. They are talking about the vaccine here. Please, I want to talk to the federal government.
To let you go, please reduce the volume of your TV set when you're calling on the show. Apologies, I have to let Edward go. Before we let you go, again, let me say many thanks for enlightening all of us and
Thanks
of course our viewers. But we have a segment where we call trending stories that bind us all, stories that affect us all. And the first trending story that caught our attention is that of the Allen Oyema, chairman of Air Peace, who recently partnered with the Nigerian Football Federation, NFF, as the air carrier for the Super Eagles. I'm sure you must have seen that because it trended on a lot of platforms. But Efo, what's your take on this?
I just want to say Mr. Oyema is he's a man of integrity, and if he has so said, he will do, if the boys are up to the odds. But the thing is, I think this is a great incentive for our sports.
At least.
It really is, because we have become a money-based people. So when you hear 20 million, their whiskers are up. They want to give it everything they've got. Do you understand?
What a good way to look at it. But let me say this: the chairman, CEO of Air Peace, has been known to be a philanthropist from time to time, and he is always rising to the occasion when the country needs him the most. So for me, it's a take of responsibility for who takes CSR very seriously. At a time when the country is stressed with security issues and we have many challenges to deal with, all that is going on presently with herdsmen, insurgencies and the like, you understand that soccer is a unifying factor, and it rose to the challenge to support what that brings unity, amongst Nigerians, regardless of your religion, regardless of ethnicity and the likes. And he pledged to give our players 20 million naira, and he gave them what is even more than that, as far as I'm concerned. What do I mean by that? For him to have even partnered with him, for him to have shared some words of encouragement, as far as I'm concerned, money cannot buy that. He also gave them some level of hope, some level of faith in the nation flag. However you look at it, we've spoken about how doctors are leaving, we are beginning to have brain drain and the likes and all of that. Yeah, that's the truth. He has continued to show his patriotism over and over again, and he has done this before during the xenophobia attacks in South Africa, lifting over over 500 Nigerians from there, even though I know that a lot of people were jealous of that his action at the time, but we are not here for that. You know, I know that he's an extraordinary Nigerian with an exceptional love for his country and also from his heart and a high level of patriotism in him. And I'm not saying this because I have any personal relationship with him. I'm not saying this because he's one of our sponsors. I'm not saying this because, you know, I trained the organization or anything. I'm saying this because we all can see what he has exhibited in the last few years. You know, his partnership with NFF when it comes to PINIC is commendable. We need other rich and affluent Nigerians to do the same. You know, and not everything lies in the hands of the government. Many people are always quick to hold government responsible. What are we doing as individuals in your own little capacity? You know, whatever power or resources we have, you know, is enough for us to say that that is a good name, or that is one of the contributions that we would like to, you know, give back to the society. So let's use this as a form of positivity to encourage other people and of course to unify the country as a whole. We have been talking about doctor strike, like I said earlier. And almost 2 months now, we've seen what is going on in the health sector. I believe a few well-to-do Nigerians can mediate and bring about a resolution towards the name Nigeria and our resources, because a lot of sectors are in jeopardy right now. When you look at the educational system as well, we've seen how the Northern and Zamfara had to shut down all schools. You know, and I'm asking myself, there must be a billionaire, there must be an Alenu Yema in Zamfara. There must be another Alenu Yema in all these northern states. What are they doing if they're about embezzling money? What are they doing when it comes to CSR? What are the accountability when it comes to giving back to their society, even to their neighbors? It starts from your neighbors. Sarah, you know, as Petition, Karim, AAA, Clan, Quincy is urging him, the International Criminal Court, that is the ICC, urging him to investigate the incessant cases of adoption of school children in the northern Nigeria, which is one of the things I just mentioned earlier. You know, let me start with you because we are both in this country together. What's your take thus far with everything that is going on, especially with Sarah, especially when it comes to the northern states?
My dear, it really is disheartening because I'm a mother, I have 2 kids, and just the thought of that number of kids being kidnapped from their school, it really hurts, you know, it breaks my heart. So first and foremost, we know that there's a big issue with security. That's where we have to start from. Security. We know that there's a problem with education. We've encouraged people to bring out your children for education. Now, the insecurity is not making this a possibility. So apart from the insecurity, the children are missing. Several mothers and, you know, the parents are heartbroken from that. Education system is going to suffer in the north because they're not going to have the trust to bring up their children and bring them out for education. You know, there are several other reasons, you know, political, backed up, I don't even know.
One thing that has always beaten my imagination is in the past administration, we were quick to call out the Goodluck Jonathan's, those on the helm of affairs of his administration and his government. And I do not know why, maybe because of the touch of military history and pedigree that Buhari carries, and that's why, and we've also seen how renegade the security apparatus can be in the hands of politicians. And that's why people are a little circumspect or, you know, reserved when it comes to calling out the government of the day. For me, the government has failed. It is what it is. The government and the leadership should be impeached if we're running a democratic setting. A state of emergency should be declared in the security sector. For failure to even label bandits what they are as terrorists, that is a huge failure on the part of the government and the leadership. And from the president to the vice, I strongly advocate that they should be put out of office in the best democratic manner. They should be impeached. I don't know why we're quick to sit down in forums like this and call out Goodluck Jonathan and say he should be impeached. But when it comes to that of President Muhammadu Buhari, we just get so reserved and all of that. Not just saying Serap has called on the ICC to investigate, not only to investigate, but we should begin to petition for these people to be impeached for failure to deliver on their promises.
Sarah petitioned for the right cause if we can't have an internal solution on the rising rate of insecurity in our country. Of course, it is better for them to involve the ICC. And our leaders have shown that they are capable of resolving our insecurity crisis, just like you mentioned earlier. Do you understand? So seriously, the adoption of children in the northern part has become like pure water selling. You know, I kept on thinking to myself that, you know, you wake up every morning, you hear news of one school or one that, you know, it's very heartbreaking. You know, I keep saying that Atanda-owo batalomo, it is those who are wearing the shoes that knows where the shoe pinches. You know, it is crazy. Our children don't even have fundamental human right, the right to education anymore, because the schools are being shut down. You know, and at the same time, you know, when it comes to the killings, you know, they kidnap at will. We are here to get them to justice. You know, let's see how the ICC will handle this petition from Serap. Till then, let's be observing. Let's hope that something productive, something positive will come out of this, because I know for a fact that Serap is also a political sector. You know, I stand to be corrected, but I'm entitled to my opinion.
So far, they've done
Yes,
well.
they've
done well, but they take their time. They take their
them,
time to
you know.
resolve certain issues. It is not well. Anyways,
There is no organization
not
that is
the
not without
judiciary.
politics.
That's the thing.
yeah,
There's always some
judiciary.
underlying
Kike, the Real
political
Talk with Kike show
goals,
has
yeah.
fought against political oppression on the show based on, I mean, for the kind of forum we have some political influence that have come, but we've seen how we've been able to, you know, push them away. So there's no organization that hasn't been without some form of political influence. But Serap, I think I'll give them a thumbs up. So
I
far.
call them the voice.
the popular activist Deji Adeyanju, who said that churches should ensure couples conduct a DNA test on their child before coming for child dedication ceremony. And before I give myself a submission on this, I want to hear your own submission, your own analysis as a doctor with everything that is going on presently in our country. Can you imagine if DNA was, you know, introduced 30 years ago? Many of us, let me not say us, many of us would not be answering our last names now. Maybe I would have been, no, I have good parents. Oh my, I have good parents.
Well, what I think is this. I want to leave it to the parents. They have the right.
Yes.
You can't really mandate people
Can push it on them.
to do a DNA test. It has to be their decision. If the couple decide to do a DNA
It's
analysis of their child, I'll leave that to them.
Okay.
Yeah.
Therefore,
I believe it's discretional. And I was just thinking, why is he centering on the church? Why the church? Why don't you say anybody who wants
Any
to do
religious,
child?
but
He
no,
doesn't-
but
do you
because maybe
understand?
that's what came to mind at the moment. So what we are trying
No,
to say here
he
is
needs to-
church,
he needs to
mosque, and
balance
the
it.
like.
No,
Yeah, so let's balance it for
no,
him.
okay, if we balance it and you say that, where's the time to carry out that kind of test before the baby dedication? Do you understand? You know, I think it's discretional. So, hey, you do a DNA test before baby dedication, okay, the results come out and the baby is not yours, so what happens? A child is a child. So what do we do?
for me, I feel it's
Why will the innocent child suffer?
I feel it's a misplaced priority for
Yes.
the man of God, pastor.
Yeah, it is.
I mean,
Is he a pastor?
He should be preaching
I don't
about.
Okay,
He
talking
should,
about
he should
the
be
church.
preaching about fidelity and all that, and not the resultant effect of infidelity.
True.
And so, if he perceives that a larger population of his congregation, you know, how do I call it, have get involved in infidelity, as a result, they have children that are not, you know,
They're
paternity
biologic,
theirs. He should preach against that and not the resultant effect.
All right, Marshall, I hear you. I think what I'm picking from what you're saying is that it is about the foundation, our homes,
Yeah,
you know, but
true.
on a serious day like this, you know, I always try to reserve our political and economic issues to Tuesdays. You know, I honestly like avoiding all these kind of shameful matters because it's very shameful. But, you know, I've come to embrace today that regardless of how we want to talk about the political or the economic issue, it starts from our home. It starts from the foundation, just like you earlier emphasized on. So the society has become worse, and I don't blame Deji Adeyanju, if you ask me, for using churches to conduct a DNA test. You know, perhaps maybe it should be talking about churches, mosques, courts, and the likes, and all of that to be able to perform all of this act. But that exercise on its own, people will have to sit tight and get serious with the institution called marriage, because when they know that they can be checkmates when it comes to child dedication, they can be checkmate when they want to do any Islamic whatever regarding their child and all of that. Maybe people might want to act better, but it is a shame that a woman with no shame, again, let me use the word, can say publicly that a legal wedded husband is assuming that the child that he has, you know, is for him, knowing that you had a child for your sister's husband. You know, it is really shameful that people have lost their sense of shame, their sense of belonging. People have now normalized infidelity. It has now become a norm. You hear all sorts of nonsense. And I really emphasize on the nonsense, you know, people saying sin is sin. My sin is different from your sin. It doesn't mean that we are not all sinners. You know, I can't even beat that thinking. You know, that somebody carrying that crazy mindset that leads us to this kind of nonsense for us to sit down here and be discussing this. I don't pray for the men in my family or those that I know end up with this type of women, because this type of women are disaster to the nation. This type of women are the ones that we should hold accountable and make them as scapegoats so that we can reduce all the barbaric behaviors. You know, this is, you know, whether we like it or not, I keep letting people understand that women are the bedrock of the society. We need to repair ourselves quickly and reorientate ourselves because of our children. Because I'm asking ourselves, what legacy are we leaving for the children? What is going on between us that we cannot even act better? It is unfortunate that with everything that is ongoing at the moment, you will see marriages today, they really don't have any form of decorum when it comes to infidelity. You will see that they don't even have, you know, they cannot even hold themselves accountable when it comes to what they should do right in the society. And you hear people say that because I committed infidelity and you lie when it comes to business, we are both sinners. Who thinks like that? May my family, may the men in my family not meet women like this. And I pray that the women, the men also, who are in this act, may they meet this type of women so that they can both marry each other and save people like us all the